Today we're going to talk about insulin management, but before we get into that, I want to give you a little bit of foundational information. In general, we have two different types of diabetes. We have type 1 diabetes, which used to be referred to as juvenile diabetes because it was generally kids who got this. Now, in type 1 diabetes, those patients do not make any insulin at all. And so as a result, the only treatment for type 1 diabetes is insulin. And that is as opposed to type 2 diabetes. Type 2 diabetes is an insulin resistance syndrome. These patients continue to make insulin, they're just resistant to it. As a result, there are lots of oral medications that can be used with type 2 diabetes. But a lot of type 2 diabetics do ultimately wind up requiring insulin as well. So insulin can be used in both type 1 and type 2 diabetes. Now, there are lots of different insulin formulations available. The oldest formulations are what's called regular insulin, which is basically the same thing that your body makes. Regular insulin is a short-acting insulin. And then we have NPH, which is an intermediate acting insulin. So regular insulin is a short acting insulin. So you take a shot of it and it gets into your system. It has a peak activity that occurs relatively soon after administration, and then it goes away relatively quickly. So it's really not hanging around after 2 or 3 hours. Now that's as opposed to NPH insulin. NPH insulin, when you take it, it's not going to have an immediate effect. It's going to ramp up over several hours, and it's going to have a peak activity later in the day and then go away more gradually. So for the longest time, these were the only two insulins we had, was regular and NPH, and those insulins were often used in combination. So these days we have other insulins that are available. We have ultra short acting insulins, and the ones that I use are Humalog and Novolog. They're even quicker acting than regular, but for the most part, you could potentially use these interchangeably. We also have basal insulins. Now, basal insulins are unique in that they do not have a peak activity. They have a plateau. You take a shot of basal insulin, it's going to ramp up and it's going to hang out for all intents and purposes all day long. As a result, there's not a lot of sense in taking a basal insulin more than once a day. However, sometimes it does have to be dosed 2, sometimes even 3 times a day. And that's usually in a situation where a patient is on an extremely high dose. The reason it has to be dosed more frequently is just the absorption is not predictable when you're giving very large boluses. So again, for the most part, you're just going to take that once a day, but sometimes you may need to take it 2, maybe 3 times a day. And remember that it does not have a peak activity like regular NPH or Humalog or Novolog. It has a plateau. One thing that's going to be common to whatever type of insulin regimen you happen to be on is what's called a sliding scale. With a sliding scale, what we're doing is we are checking our blood sugar, and then we're comparing that to a chart that will tell us how much correctional insulin we need to take. And with sliding scale, you are reacting to something that's already happened. You've already allowed your blood sugar to get high, and now we're going to chase it down with a short-acting insulin. So that is not ideal. Well, we would rather keep those blood sugars from getting high to begin with, but still a sliding scale can be very useful. The amount of sliding scale insulin that you would need to take depends on how sensitive you are to insulin. So here's a chart that shows us a low intensity scale, a medium intensity scale, and a high intensity scale. So using these, you can take a correctional amount of insulin to take your high blood sugar and get it down in a more reasonable range.